What is a heart attack? What does it feel like, and what's happening in your heart? Hi, I'm Dr. Anthony Komaroff. A heart attack is almost always caused by a disease of the coronary arteries called atherosclerosis, the same condition that causes the chest pain called angina. When a heart attack starts, it can feel like angina, a squeezing sensation in the center of your chest. You may also be short of breath, sweat for no reason, and feel lightheaded or nauseated. But unlike angina, which usually occurs when you exert yourself, a heart attack can start when you're at rest. And with a heart attack, the symptoms are more severe and they don't stop after a few minutes. The reason is that what happens to your heart during a heart attack is different than what happens during angina. In a heart attack, blood flow to one part of the heart muscle literally stops, and that part of the heart dies. Let's take a look at the heart. On the surface of the heart lie the coronary arteries. Right now, this heart is pumping normally, and blood is flowing to all parts of the heart muscle. The heart is getting the blood it needs. But if the blood flow is blocked for long enough, that part of the heart muscle dies. Take a look at this spot where the arrow is. Right at that spot, inside that coronary artery, a plaque, a buildup of cholesterol, has stopped the flow of blood through the artery. A part of the heart muscle that was pink goes pale. When the muscle dies, a gray scar forms. That part of the heart no longer pumps forcefully, so the rest of the heart muscle must work harder to pump blood. So how does this happen? What suddenly blocks the flow of blood through an artery, causing a heart attack? There are two ways that blood flow can be suddenly blocked. To understand them, we need to look inside the artery. Here is a big plaque that's blocking the flow of blood, not completely, but pretty badly. This kind of plaque can cause angina whenever a person's heart has to work hard. Now, if a little blood clot traveling in the blood becomes trapped between the plaque and the wall of the artery, it can suddenly block the flow of blood. Boom! Unless that clot quickly dissolves, it's going to cause a heart attack. So now you can see how someone who has angina that slowly gets worse may someday have a heart attack. But how do you explain the person who ran a marathon on Saturday and then had a heart attack on Tuesday? How does a person who seems to have very healthy arteries one day have a heart attack a few days later? How can a blockage occur that quickly? Not long ago, we had no answer to that question. Now we understand a whole new way in which a heart attack can happen. Indeed, it probably is the most common way. To understand, let's look inside the artery again. Here's a fairly small cholesterol-filled plaque. It's not interfering with blood flow much at all, so it's not causing any symptoms. Here's the pool of cholesterol inside the plaque, and this is a fibrous cap that grows over the plaque and holds the cholesterol inside. Sometimes inflammation inside the plaque weakens the fibers. Suddenly, the cap breaks. When that happens, the cholesterol inside spills out into the artery. A blood clot forms where the cap has ruptured. The clot plugs the artery and stops the blood flow. That's how a person can be fine 1 minute and a few minutes later have a heart attack. To find out more about the condition that causes a heart attack, see the video, What is Atherosclerosis? And to find out more about the milder kind of chest pain that can be a warning sign of a future heart attack, see the video, What is Angina? From Harvard, I wish you good health.